In this video, we'll be discussing the oral anti-diabetic drugs. Now, the broad classification of oral anti-diabetic drugs, we have those that enhance, the drugs that enhance insulin secretion. Number 2, the drugs that overcome insulin resistance, and number 3, certain miscellaneous drugs. Now, under the drugs that enhance insulin secretion, we have two important groups: the ATP sensitive potassium channel blockers and the dipeptidyl peptidase 4 inhibitors, or DPP4 inhibitors. Now, under the ATP sensitive potassium channel blockers, we have two groups: sulfonylureas and meglitinide analogs. Then under drugs that overcome insulin resistance, we have biguanides and thiazolidinediones, and miscellaneous drugs like alpha glucosidase inhibitors, amylin analog, dopamine or D2 agonist, sodium glucose cotransporter 2 inhibitors or SGLT2 inhibitors. Now let's look at a mnemonic to remember these drugs. Now the mnemonic is: the king's men dropped battle with Assad. So you can see the highlighted letters here to represent the class of drugs. Now K stands for ATP sensitive potassium channel blockers, and the two groups of drugs that are underneath come under this are the sulfonylureas and the meglitinide analogs. Now sulfonylureas, we have two simple examples: glipizide and gliclazide. Now under meglitinide analogs, just remember repanate. So meglitinide, so repaglinide and nataglinide. So meglitinide analogs, we have the another code called repanate, repaglinide and nataglinide. So these are the ATP sensitive potassium channel blockers. So again, sulfonylureas like glipizide and gliclazide, and meglitinide analogs like repaglinide and nataglinide. Now coming to DPP4 inhibitors, just remember saxi-sida. So we have sitagliptin and saxagliptin, and another example is vildagliptin. Okay, so these are the DPP4 inhibitors: saxi-sida, saxagliptin and sitagliptin, and just remember vildagliptin. So these are the drugs that enhance insulin secretion. Now coming to the drugs that overcome insulin resistance, these are the biguanides and the thiazolidinediones. Now the important example of biguanides is metformin, okay, and thiazolidinediones, just remember this, pioglitazone. Okay, so these are the drugs that overcome insulin resistance, again biguanides and thiazolidinediones, and the example of biguanides is metformin and that of thiazolidinediones is pioglitazone. Now coming to the miscellaneous drugs, ASAD. Now A stands for amylin analog, and the example for this is pramlintide. Amylin analog, pramlintide. Now S for the sodium glucose cotransporter 2 inhibitors, and these are dapagliflozin and canagliflozin. Dapagliflozin, canagliflozin. Then the next A stands for the alpha glucosidase inhibitors, just remember acarbose and voglibose, and the D2 agonist is bromocriptine. So again, the code is: the king's men dropped battle with Assad. K stands for the potassium channel, the ATP sensitive potassium channel blockers like sulfonylureas and meglitinide analogs, sulfonylureas, glipizide and gliclazide, meglitinide analogs like repanate, repaglinide and nataglinide, DPP4 inhibitors, saxi-sida, saxagliptin, sitagliptin, and just remember vildagliptin. Then we have the biguanides, which is metformin, thiazolidinediones, pioglitazone, amylin analogs, pramlintide, the sodium glucose cotransporter 2 inhibitors like dapagliflozin, canagliflozin, alpha glucosidase inhibitors like acarbose and voglibose, and D2 agonist called bromocriptine. Now the important drugs that you may forget or that you need to keep on revising are the thiazolidinediones. The example is pioglitazone, and the example for SGLT2 inhibitors, dapagliflozin and canagliflozin. Now for your exams, the most commonly asked questions come from the sulfonylureas, their mechanism of action, their side effects, and biguanides is another important question, their mechanism of action and their side effects. And the rest of the drugs, they can ask, okay, give two examples of sodium glucose cotransporter 2 inhibitors, so dapacana, Then give two examples of meglitinide analogs, or apanate or apaglinide, nataglinide. So this is the drugs, the oral antibiotic drugs.